Hey, it's Nate from Navigator Bookkeeping and talking today about opening a second or multiple locations. A lot of practice owners are thinking about this. We get this question all the time. Hey, I got this great new space. It's a great deal. I want to move to it and get started with another location. We hear this all the time too, even people who have just opened the second or third location. Hey, another great deal. My landlord told me about this space. We can expand, we can grow. I'm going to move into this space. That's great, and expansion and scaling is great. But here's the metric to think about, maybe even the matrix to think about before you're moving into that new space. I'm going to give you 4 things to check and think about before you move to that new space to make sure that you're set up for it. It's not going to be a huge cash flow crunch, because I can say that one of the leading causes of cash flow crunches in private practices is actually moving to a new space. Higher rent, higher utilities, paying for furnishings, paying for new furniture, clinicians that are ramping up, costs that are high. It's a tough situation. So let's talk about the 4 things that you need to make sure are set up and are yeses before you move. And we'll also talk about just some of the risks to be on the lookout for when you're moving to that location. So first of all, the kind of context to think about here with all of this is that the timelines are different. Your timelines between your expenses at your second location and your revenue at your second location are very different. Your expenses pretty much all start at the beginning or are front loaded. If you think about it, when you're moving to a new space, oftentimes you have build out costs that you maybe need to front right at the beginning, or maybe they're tacked onto your lease. But either way, those costs are starting right away. Along with that, your rent itself, any utilities, any triple net, CAM, any of those type situations, all are starting right away as well. So those costs all start right away for you. Plus, you're gonna have things like signage, buying furniture, furnishing your space, making it look nice and hospitable, getting snacks, getting different desks, chairs, computers. All of that adds up very, very quickly. So on the timeline, that all starts right away. But on your revenue side, think about how long it takes for a clinician to ramp up. If you're watching this, you probably know that, and you know that painfully well, that most clinicians take 3 to 6 months to really ramp up from no sessions to full, 80, 90 sessions a month, something like that. Now, you may have a situation where you have somebody coming in and maybe they're bringing some clients along with them, or maybe they're well known in the community, so that's going to be faster. But either way, getting that ramp up is going to take time. It's not going to be instantaneous, whereas those costs are instantaneous, right? So you see that timeline difference? Costs jump right away, revenue ramps slowly. The gap between those is really the risk that comes along with a second location, because we can see, hey, this will work out eventually. The numbers work. We've run the numbers. We know our break even point of, we need 100 sessions or 200 sessions to be profitable here at the second location. But the gap between those 2 timelines is really where the issue happens. So what do we do to fill that gap? We need some sort of reserve fund. Ideally, you set aside 3 to 6 months of expenses for that new location before you move to that new location. This is separate from your emergency fund, which should be 3 to 6 months total. That's for emergencies. That's not for expansions, right? An expansion is not an emergency. You should not be pulling from the emergency fund for an expansion. Again, if you've done any of these things, no shame, no judgment. It happens. You got to do what you got to do. But this is just, we're talking, what's the best way to avoid cash crunch? This is the way to do it, okay? So you have that emergency fund, that's separate. Have a scaling or growth or something like that fund. Save in it for the next, the 6 to 12 months before you move, and be prepared for that. But again, 3 to 6 months of that new location's overhead would be great. And that's going to help you cover that gap between the revenue jumping up and the expenses being there immediately. Plus, if you know that the build out is going to be expensive, you may want to save for that on top of that as well. So that's the context to think about, right? The difference between revenue, expenses, and kind of the timeline with that. Now let's talk about really the 4 things to even think about even before you move. Really that matrix of like, should I even move? Should I make this change? So the first one, look at your capacity, right? Look at the capacity of your existing location. Where are you? If you're at 80% or greater, meaning you're quite full, right? And there's only 20% or less of slots available, then that could be a good time to be saying, yeah, we're pretty full here. We're going to be hitting a wait list pretty soon. You probably have multiple clinicians who are already full. Let's make this happen. Okay, that's the first one. Are we at 80% capacity or better? Maybe I'm saying 80% closed capacity, right? 20% open capacity. If you're thinking about utilization, 80% would be the number. We talked about the emergency fund and the scaling fund, but do you have 3 to 6 months of that new location's expenses in reserve in a scaling or growth fund. Third one, do you have clinicians that are committed and ready to go to this new location? Or are you planning on just like expanding, doing the work, and then hiring someone once you're there? If it's that second option, that 3 to 6 months that's going to take to fill up a clinician is now even longer, because now you have to go through the process of hiring someone, maybe paneling them, all those things. So make sure you have a clinician committed, at least one clinician, maybe multiple clinicians, depending on the space and the size of it, how many offices there are. But make sure you have a clinician committed to that location before the doors open. And then fourth, from kind of a bookkeeping perspective, one thing that can be really helpful to do is to have books set up to track each location separately. Now, you could go as far as completely separating QuickBooks and having separate locations on there, or you could just use our clinician profitability tool, and we could separate your clinicians on there to figure out where that forecast looks like. I actually usually would lean towards the second option, as far as it's going to save you a lot of time and effort. It's going to save your bookkeeping team a lot of time and effort. But putting everything into the clinician profitability tool by location is going to give you a great forecast of what that profitability is going to look like, what the revenue is going to look like, how long it's going to take to get there, what we can expect as far as break-even costs. If you're doing it inside of QuickBooks, you are going to get really granular, but that's also going to take a ton of time and effort, and that's not always worth it compared to what you can just see on a forecast tool like the clinician profitability tool. So that's your matrix. Those are the 4 things to think through, plus the context to be thinking about with that location. If you're thinking about expanding, hopefully this is helpful. If there's something holding you back, whether that's understanding the numbers, trying to figure out where you are on any of this, whether that's utilization, savings, anything, schedule a call. Let's look at the clinician profitability tool together, and we can figure out those numbers a little bit more.